Hi, my name is Kiara Klitsch, and I will be discussing healthcare-associated infections in this presentation. I will be covering the definition, common forms of infection, trends and statistics within the U.S., and interventions in place, as well as my recommendations, along with Healthy People 2020 objectives. A healthcare-associated infection, or an HAI, is an infection a patient develops while getting medical care, and they are usually preventable. A device-associated infection, or a DAI, is a form of HAI where the agent of infection is a device used in the healthcare setting. The most common HAIs are catheter-associated urinary tract infections, surgical site infections, central line-associated bloodstream infections, ventilator-associated pneumonia, and Clostridium difficile, which is a microorganism that can cause issues in the intestines. We commonly hear about bloodstream infections contracted for medical care, which include central line-associated bloodstream infections and methicillin-resistant Staphylococcus aureus, or MRSA, which is a dangerous drug-resistant infection that is bred in hospitals due to the overuse of antibiotics. According to the Mayo Clinic, MRSA typically starts off as a swollen red bump or nodule, which continues growing and will not heal. This infection could either stay on the skin or it may deepen and cause damage to the organs, bones, and tissues. Normally, patients' immune systems are able to fight off infections by using the two main barriers, which are skin and mucous membranes, such as the nose, mouth, and eyes. However, these devices surpass both barriers and provide pathogens the perfect method of entry. To add to this, the devices also allow the transfer of the pathogen from one part of the patient's body to another, from healthcare worker to patient, or from patient to healthcare worker to another patient. According to the U.S. Center for Disease Control and Prevention, nearly 1.7 million patients receiving healthcare develop an HAI, and about 1 in 17 patients die from said infection. Multiple studies show the prevalence of patients acquiring an HAI differs between high and low income areas. These infections are not consistent globally, and the World Health Organization states that the burden of healthcare-associated infections is several-fold higher in low and middle-income countries than in high-income ones. This could also play into the staffing of nurses, as it has been shown that hospitals with low nurse staffing levels and patient overcrowding leads to poor adherence of hand hygiene and has been associated with higher adverse outcome rates and hospital outbreak investigations. In an ICU setting, it was demonstrated that understaffing of nurses can facilitate the spread of MRSA through relaxed attention to basic infection control measures. This figure shows the incident rate of HAIs in California from 2015 to 2018. As you can see, SSIs continue to be a significant source of infection. The dashed line reflects the national baseline for the standardized infection ratio, also known as an SIR, and then SIR below the line shows HAI prevention progress. However, the line is alarmingly high as it is. Long-term acute care hospitals, which provide complex care to patients that typically require prolonged hospital stays, continue to show little progress in HAI prevention and are unlikely to meet 2020 HAI reduction goals, as stated by the California Department of Public Health. California has an extensive intervention program based on CDC recommendations in order to control and prevent HAIs. However, the recommendation mainly focuses on preventing transmission and increasing reporting of these infections, and less on keeping the infections from happening in the first place. Healthy People 2020 also has intervention programs designed to combat the prevalence of HAIs, which highlight improving the compliance of hand hygiene procedures, preventing transmission of MRSA within nursing homes, using masks, gowns, and gloves for reducing MRSA in a hospital setting. My recommendations are to raise standards in terms of personal hygiene in a healthcare setting, whether that is increasing the frequency of hand washing or increasing consequences for not following procedure. Screening for MRSA in patients before any surgical procedure is done can limit transmission and benefit overall health outcomes. Annual education on the subject. This could even be in the form of an annual seminar to remind healthcare workers of the importance of hygiene and dangers of inadequate compliance. Thank you for listening, and I hope you learned a little bit more about healthcare-associated infections.